Hi everyone! I'm Jasmine Buan. I'm 20 years old and I'm a psychology major studying in Manila. I found out about CSA through one of their YouTube videos, just like this one. It was just a random night. I was just scrolling through YouTube looking for videos to watch, and I stumbled upon one of Doc Tessa's YouTube videos, which was the instant nose slip. So immediately I was intrigued because I've always wanted to have my nose done because I've always been insecure about it growing up. Because as you can see, hindi siya ganun katangos. It's more of a typical Filipino nose. So I wanted to look a bit more like a Korean-inspired nose, if you will. But before that, actually, I've looked through various clinics or so-called clinics that offers the instant nose slip procedure because I wanted to narrow it down to which clinic offered the best deal and the best service for this kind of procedure. Kasi if you want this kind of procedure to be done on yourself, it's really important to note that it should be done by a professional, just like Dr. Contessa, because they didn't just study this overnight, obviously. They studied this for years and years, so they know what they're talking about and they know what they're doing. Kasi ang dami ko na nakikitang mga clinics or yung mga iba spa, and unfortunately, some of them don't have the necessary qualifications to be doing non-surgical procedures. Yung iba sa kanila, they're non-medics or they don't have much experience in the medical field. So if you see or know a clinic that offers this kind of procedure, you should first ask them about their credentials or necessary certifications, the authenticity and safety of their products and materials, and obviously if they are licensed. Or if you want, you can just go straight to CSA and have your procedure done here. Kasi I'm telling you guys, napakagaling ni Doc Tessa and the quality of their service here is just A+. So ayun, eventually, I decided to have my first procedure done here at CSA by none other than Dr. Contessa. So guys, don't forget to click the subscribe button and the notification bell to keep you posted.
Good day everyone! Welcome to the new CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician here at our CSA Medical Aesthetics. I'm so excited today because we have a new guest and let's all welcome Miss Jasmine Buan.
Hi po.
Hi Jas!
Hi po, Doc.
Yan. So, first time to join us in this CSA videos. Okay, so mga ka-CSA, actually our topic for this episode would be very special. So most of the time you see us doing a lot of non-surgical procedures, specifically the nose lifting. And I think Jas was able to view those episodes, correct?
Opo.
Right. And this is special because we wanted it to be more of a scientific approach and also an anatomical approach on non-surgical nose lifting. Since Jazz here is a psych student, 4th year, right?
Yes po.
Baka po mag-medicine pa. May plano?
Depende lang.
Depende. Okay. So the medical or anatomical approach of non-surgical nose lifting will be explaining to you the different anatomical layers of the nose part, as well as the blood vessels or the supply, the circulation, and also some important structures that we need to avoid when we do non-surgical nose lifting. Okay. I think na-mention kanina ni Jazz sa intro niya na don't just go to any clinic or
may iba,
some
spa.
people or even spa.
Yes po.
Oh my goodness, na gumagawa po ng non-surgical nose lifting. I think I've heard from some of my clients too na they've heard of this spa doing these injections on the nose. So actually it's already a red flag. Okay, it's kind of scary because the nose region is the center of the face, but it's also called a danger zone of the face. Okay, so yan, danger area also. That's why those who are doing this should be really licensed medical doctors who are trained to do non-surgical procedures like this. Kasi hindi naman lahat ng doctors are doing this. So doctors who had done like aesthetic training or cosmetic surgeons, aesthetic surgeons, or mga dermatologists who underwent trainings like this, then we could say na it's very safe to go to these professionals. Okay? Because I think, nakikita ko pa nga, parang Korean nose for only, ayun, may presyo. Ang mura-mura. So cheap. Pero we don't know ano ba yung materials that they're using. Plus, are they doctors? Okay? I think some are just estheticians or I think meron pang nurse. Okay? But, you know what? In this kind of procedures, I will really advise you as much as possible to go to certified aesthetic doctors or kasi sa mga physicians, we underwent a lot of studies on the anatomy. The anatomy study that we did was so detailed. Talagang lahat-lahat yan, inaaral po namin. And we do a continuous education for this one too. So, lagi kaming may mga cadaveric workshop, anatomy workshop. Even I, at my age, I'm so old, I still continue to study, I still continue to review, I still do cadaver workshops, okay, and seminars, all of these things. I just don't know how they're able to learn things like this. They just inject on your face using products na they would say very cheap. Okay, and take note also, anything you inject on your face, be very careful. Because the materials that are used should be studied clinically. Okay, so meron silang mga clinical or scientific studies. They've went through a lot of trials, clinical trials already. That's why our FDA, the FDA should be approving these materials, right? Kasi I really got scared when I've heard na meron daw gumagawa ng ganitong procedures na sa spa. Okay, so take note again, our nose is a danger area, particularly using those filler injections. Okay, because I think some of you have heard of worse complications from filler injection, blindness. Okay, so we don't want that. And that's why if you do procedures like this, make sure you only go to your really certified or licensed aesthetic doctors, your surgeons, your dermatologists, okay? So yun lang po. I think this is a very important episode right now, okay? Because when something wrong or like there's a complication that could have happened, of course they will refer you to the doctors also, okay? So praying na wala pong nagiging problem when it comes to these kinds of treatment. Okay, just a review po. I have some viewers also who are in the medical field, in the aesthetic medicine already. Those who are watching this is gonna be a review for all of us. Okay, so the plane of our nose or the external part of our nose. We already know that. So on this part, the lowest portion is called our radix. Okay, and then we have the rhinion here, the connection between the nasal bone and nasal cartilage. And then as we go to there's a supratip here, the tip, defining point, and an infratip. So we know that. And then we call the sides the alars. And then we have the columella there. Okay, so blood supply, we understand that our nose has its own circulation or the blood vessels also. Okay, so actually from your facial artery, there's gonna be a lateral nasal artery that's gonna branch out here. Okay, and then we have an angular artery here from your facial artery, and also on the upper layer, we have the so-called dorsal nasal artery. Okay, the dorsal nasal artery could be a branch from the part here. We have a supratrochlear artery, which is from the ophthalmic artery. Okay, ang dami ng arteries niya, no, Jess? Okay, now the supratrochlear artery is actually a branch from the internal carotid artery via the ophthalmic arteries. That's why there's an anastomosis of the internal and the external carotid arteries. So that's where they connect. Take note of that, ha? Yung dito, yung supratrochlear, so it could give off the dorsal nasal artery. There are also anatomical variations. Some of the dorsal nasal artery could be a branch of the angular artery from the facial artery. So we also have that. Imagine, not all people have the same kind of anatomy, same kind of branching. There are variations also. Okay, so those are the blood supply, important. And then also on the radix part, there's this intercanthal vein. So this center here, okay? And when we go at the tip area, there's so many branches of those blood vessels that connect or anastomose. So yung dorsal nasal artery, lateral nasal artery, they have connections here together with the columellar artery. So the columellar artery could have branched out from the superior labial artery. Okay? So if you see some pictures in anatomy book showing all those vessels, then you can see, oh my goodness, the nose pala has a lot of interconnections of those blood vessels. So very, very careful dapat po tayo when we do injections on the nose. And then there's also these 5 anatomical layers. So we start with layer 1, the skin, layer 2, the superficial fatty layer, layer 3, fibromuscular, layer 4, deep fatty layer, and layer 5, yun na yung perichondrium and periosteum. So when we do our injections, anatomical plane will be between the layer 4 and layer 5. So we're on top of the periosteum and perichondrium. So when we inject our product, like a filler or a thread, we stay between the layer 4 and layer 5. Now in your layer 2 and 3, we have a lot of our blood vessels there. So that's a danger area. Okay? And when we insert our filler or the threads, as much as possible, we don't want to go on the superficial layer kasi magiging visible yung product and the presence of those blood vessels. And another question pala, is it safe to combine filler and threads? I think you've seen a lot of our videos combining hyaluronic filler and our PDO threads. So we have shown you that this kind of combination is very safe, okay? So these are biocompatible. So your PDO and your hyaluronic, they're compatible with each other. There's no like counter reaction. Okay, I think I had a patient telling me that he has heard it from another doctor saying that you cannot combine. But actually, we've been doing this. It's been a decade already that's being done, so no worries. Take note, hyaluronic is a natural substance present in our skin. So when we have a PDO that we insert there, it's not counter-reacting or not really fighting that other molecule there. Okay? So far I have discussed a lot of important informations for all of you. So later on, we'll be doing the non-surgical nose lifting for Jazz sa pagbabalik ng CSA Medical Aesthetics. we're back mga ka-CSA. So we're now at the part of doing the actual non-surgical nose lift procedure for Jazz. So we started with putting on a topical numbing cream, and after the numbing cream, we have to also cleanse the area, disinfect everything, sterilize the skin, and then right now we're gonna inject lidocaine into the infratip region. So I have my lidocaine here, and I have this gadget here. Somehow it will help the patient ease or kind of lessen the discomfort. And then I'm gonna pinch the nose area and then inject into the infratip region or the tip region. So just a small amount of my lidocaine. Okay, there you go. So just like a 0.1 of the lidocaine, and then so we're gonna clean the area again. Okay, so Jazz has the Asian nose with rounded tip. Okay, so the Filipino nose, most of the time when you check on their nasal tip, it's rounded, and nasal spine is flat. Okay, but actually there's also a good bridge here. We just wanted to make a definition of the nasal bridge. Okay, and then also the tip projection. So we're gonna follow again our angles, the nasofrontal angle 130 degrees, and then the nasolabial angle for women, we wanted it like 100 to 105 degrees. Okay, so I'll be starting with my single entry point, okay, infratip region. So here you go. And then I'm combining both filler and thread. So I have my hyaluronic filler here, and then the anatomical plane between layer 4 and 5. So just glide your cannula into the radix, okay, and then pushing our filler there. So the filler also has a lidocaine with it, so it helps in numbing the nose structure. And then after our dermal filler, we can proceed with the tip projection. So I have here same material, same product, okay, towards the nasal spine. Okay, inhale, exhale, Jazz. So I'm actually in this region of the so-called septal cartilage here. Okay, some resistance. Then you have to really reach the nasal spine, anterior nasal spine, and inject there around 0.2 to 0.3 of your dermal filler to give that lift or projection of the nasal spine. Okay. So again, this has a lidocaine. It will help in numbing the area also. I'm gonna use my PDO threads. Okay, my first PDO thread. So the number of threads that you're gonna use will really depend on the desired height and also anatomy of the nose. Okay, so there you go. So we already are on our 4th PDO thread. 5th PDO thread. And so if you already feel some resistance, so I'm just gonna be going to finish with this last. Okay, and then we'll proceed with our nasal tip projection. So with my tip projection, I make another entry point, like a 0.5 cm above that, and I'll be using a 40mm thread here. Okay, sponge. Then I'll pinch my columella to really grasp the entrance of this PDO, and another one 40mm, and we're done. So we'll be showing the outcome to Jazz. Back mga ka-CSA, so we are now at the part of showing the outcome to our guest. So Jazz, here's the mirror. Ayan na. Excited? Yay!
Hala, grabe.
Okay.
Hala,
Yan.
ang ganda. Akala
Right.
mo surgery.
Yeah, it seems like a surgical
Grabe.
result. Right. Ang saya ng ating guest, si Jazz. Yeah.
Oh my God,
Take
I
note,
can't.
Jazz is just 20 years old, right?
Yes po.
Yeah. So she looks like a Korean. So for those who wanted to achieve like a Korean nose, Yan ang technique natin. So we were able to elevate the radix, define the bridge, made it sharper because some individuals want to have that sharper look. Okay, parang surgical result nga. And then what I wanted yung sa nasal tip, it was rounded a while ago and it was droopy. Right now we were able to upturn it and made it less round. So parang Korean nose na rin po. So yung kanyang lower part, yung sa may nasal tip, so na project natin, we were able to lift it and we were able to show the columella as well. So making the sides of the nose narrower. So that's one way to reduce the sides of the nose or make the so-called alar narrowing, to inject or put filler and threads onto the up to the nasal spine and then filling in the columella and making it pointy nose. Yan! So happy with the outcome. OS. Yan. So the entry point, okay, just pinpoint bleeding lang. Later on, it's gonna close. We'll be covering it with some duoderm. And so Jazz is so happy. Any message sa ating mga televiewers, Jazz?
Saya ko.
Speechless.
Sobrang speechless. I just can't express myself
right
now, but punta na kayo dito sa CSA. You won't regret it. I promise.
Yeah.
Ang galing mo, Doc. Grabe.
Glory to God.
Thank
Praise
you,
the
Lord.
Amen.
Dream come true.
Exactly. I'm so happy for Jazz right now. Okay. Because I think she was sending me a message before, like she told me she was watching the videos and she was impressed with the results na nakikita niya with our other guests. And she had experienced it right now and bumagay sa kanyang face, tama lang. Okay, so she has a small face, narrower face. Parang yung effect din, no? Parang nag-slim din yung face, right? Okay. So again, we are really, as much as possible, we wanted to advise you all who are thinking of doing non-surgical nose lifting or nose injections. Wag lang po silang magtungo sa kung sino-sino lang po. So do a research on them. In the past, they were doing nose injections using permanent fillers. Those were the silicone gel or hydrogel. They were saying it's collagen gel. It's not actually collagen because collagen is not permanent. It's not lifetime. Even our own natural collagen, merong lifespan. Anything from nature, anything that's natural has a lifespan. So these are not permanent. So yung mga in-inject before, I think those were early 2000. So I've had some patients coming to me, they had nose injections with a permanent type of a filler. Well, my advice is that don't put anything, a permanent substance on your face because our face, as time passes by, the morphology changes. So if you put anything that's permanent, it can actually give you a permanent problem. It will not adapt to the changes that's happening on our face. So that's another advice. Because I have patients right now, yung mga na-injikan noon, may mga silicone gel, hydrogel, meron pa yata wax or paraffin wax. And then, at first, they were saying it's nice, it's beautiful, and then as time passes by, it damaged structures inside their nose. And then I've seen most of them nag-enlarge yung nose nila, the tip, the columella, nag-widened. So that's already a permanent problem. Unless you do a surgery, a surgical removal of those injected materials, that won't be solved. Because some patients are asking me, those who underwent that before, is it okay if I do also injection like PDO threads? However, I advise them to go to a surgeon, evacuate muna yung mga na-inject. However, not all of those silicone materials or whatever the material was injected, hindi lahat na i-evacuate or na-remove. Some of them already lodged in the tissue layers. So parang naka-adhere na, nakadikit na. And the surgeons could no longer remove those. Otherwise, baka wala ng tissue sa nose. Okay? So, don't use anything that's permanent on the face. It can give you a permanent problem. Yeah, you're thinking that it's one-time injection, one-time procedure, but take note, anything that's not natural could also give us problems or complications in the future. So I'd rather do something like this na, these injections naman, somehow, they last in a certain period of time. Okay? Like, I had patients nagpa non-surgical nose lift sa akin, 2 years, 3 years, iba pa nga, meron pa nga 5 years, dun lang umulit eh. So, I'd rather use something that's natural, that's from nature. Again, anything from nature has a lifespan. Kahit na mag-ulit-ulit na lang ako, wag lang siyang mag-cause ng problem in the future. And actually, our face, nag-evolve. Yung mga tissues sa face natin nag-change. So, pag meron kang permanent product dyan, over time yan, magkakos ng heaviness yan, bibigat yan. So, magiging problem mo rin. So, use something that's very, very safe and also very natural to give us natural result. Okay? So, thank you, Jess!
Yeah. Actually, I have a question. Do I have any foods that I need to avoid po or physical activities? Kasi
Yeah.
I'm a very active person, work out every day, so
As of now, Jess, avoid muna heavy or strenuous activities kasi you had an injection on the nose. So, huwag mo na din magbuhat ng mabibigat. And also, avoid yung mga allergogenic types of food. Yung mga malalansa, okay? Now, just, precautions lang just to avoid further swelling. Although, the next day, expect lang some soft tissue swelling, but it's gonna be gone in few days lang. So, just do ice compress. Then, we're gonna give you also some prophylaxis, antibiotics, and pain reliever or any anti-swelling. Okay? That's it lang. Rest ka muna. Stay home muna.
Thank you,
Okay. And by the way, mga kasiyasay, since I think I had some clients asking us kung meron kaming COVID rapid test, it's available here at our center, the rapid COVID testing po. So we have some patients na nag-ask na sa akin, and those who would want to do that, it's also available here at the CSA Medical Aesthetics. Ayan, kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Derm Centre, and our Instagram, CSA Derm Centre. Our new clinic is located at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And hopefully you are watching most of our videos and you can check them at our YouTube channel, Contessa Salvador. Ayan. And please like na rin po or press on the subscribe and the notification bell. Ayan. Maraming salamat po. Thanks, Jess.
Thank you, Doc.
Okay. Salamat po sa inyong lahat. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.